Good evening. My name is Angela Fullwood, and I'm the supervisor for family and community engagement for Hillsborough County Public Schools. And so I want to again welcome you to tonight's session. I'm so excited. It takes a village. With us tonight, we have Dr. Traci Thompson, and she is the founder and CEO of Dr. Traci's House. Dr. Traci's House is a nonprofit organization which is dedicated to improving not only the health and wellness, but the sustainability of people in our community. So with that, I want to welcome none other than the beautiful Dr. Traci Thompson. Thank you so much for being with us tonight.
Thank you. Thank you so much for having me. I'm so excited to be here. I'm going to get started. And as Angela stated, if you have questions, I want this, even though it's a webinar, to be very interactive. So please ask questions in the chat, and Angela will go throughout the presentation, but also at the end to get your questions answered. So I will begin. And as was stated, the topic today is It Takes a Village, and how my nonprofit, Dr. Traci's House, is seeking to transform the community one child and one family at a time. So to start, I wanted to go over sort of the agenda for this evening. And I'll talk a little bit about myself, how I came about the idea of Dr. Traci's House, then go and describe some of the features of the organization, next steps, and then, of course, questions. So a little bit about myself, you can read that, but I'm going to tell you a little bit about myself personally. I was born and raised in Maryland by a single mom of 3. And she raised us on $17,000 a year. She worked as a nursing assistant in an Alzheimer's unit in a nursing home. And growing up, I never realized until later how many people, whether it was my grandparents, my aunt, my aunties, my mom's friends, parents of my friends who gave of their time, provided my mom and my siblings with food, with clothing, with housing, shoes, and was that village that helped me every step of my journey. And even before we moved into Section 8 housing, we stayed with my mom's best friend and then with my grandparents. And I started school at the age of 2. My mom was a room mother for my sister, who was about 18 months older than I. And so when she went to Head Start, I tagged along with her. So I was able to go to Head Start with my older sister, and then when it was my time, I went to Head Start. But school to me was a safe haven. It was a place where I got to escape all of the stresses of my life. Not knowing as I got older in middle school and high school, not knowing when the electricity would be turned off or when the phone would be cut off. The stress of not having enough to eat, and especially during the summertime, making creative ways of how to eat sandwiches. And those sandwiches would include bread and ketchup. And that might be a reason why I don't like ketchup now. And then also the embarrassment. As I was older and was in high school, I was in a sort of a magnet program, but I was bused into another school, a different part of the district. And I was the only one on free lunch. So having to provide the lunch tickets to during lunchtime, I realized that, I was different than other people. But it was because of my teachers and that village that helped me believe in myself and to see things and to aspire to be a physician, to aspire to be more than what I saw around me. And I was able to get a need-based scholarship to Georgetown University. I was a chemistry major, and then got a merit-based scholarship at Johns Hopkins. I've been in Tampa for the past 10 years. I worked at WellCare. I was their former chief medical director and was responsible for their Medicaid and Medicare Advantage plan, really focusing on ensuring that members got the right care at the right time. But in January, right before the pandemic, my career came to a crossroads, and I had an opportunity to really look back and to see what I've done through the course of my life and how there was a village for me. And so I wanted to, again, follow my passion and give back to the community. And that's where I thought about all the things and all the people that I've touched throughout my career as a chief medical director, and of the house that Dr. Traci built. And so hence I came up with Dr. Traci's house. And so I wanted to be able to focus on the area within Hillsborough County that shows the most need. And so I looked at the community health needs assessments that was performed in 2019 by the big hospital systems here. And I was able to see that there were certain zip codes in Hillsborough County that had the most disparities, that had the most social risk factors in terms of education, the income, and I wanted to be able to see that for myself. So being the scientist that I am as a chemistry major, I wanted to do the primary resource, and that being the US Census Bureau. So that's what I'm going to show you before going into Dr. Traci's house. So you'll see how I took a picture and looking at the demographics of, and again, the area is going to be is East Tampa, and how that translates to what the types of programming and the collaborative partnerships that we're going to have at Dr. Traci's house. So when I wanted to look at, again, all of this, majority of this information comes from the US Census Bureau. And I'm going to put a little plug in. The big push for the 2020 census was last year, but I would encourage you, if you do get an opportunity to take surveys in your community, whether it's a community survey or health needs assessment, many people look at this information. I'm looking at and sharing this information with you, but the federal government, the state and local governments, school districts, they look at this information. So it's important that as many people can participate. So looking at the characteristics, and it's by zip code, Hillsborough County and the state. And I had picked the top 3 zip codes. So 33605, 33610, which on the census tract describes East Tampa, and then 33612 in the university area. But the top 5, rounding out the top 5, is 33613 and 33604. And you see in terms of the bars, the blue bars indicate the kids under the age of 5 and the percentage. And then you also see the the orange bars. These are the persons under 18 years of age. And you see that compared to the rest of Hillsborough County and also with the state of Florida, that this area has a significant amount of percentage of young kids. So this is, again, looking at opportunities for after-school programs, for workforce and training programs geared to school-age children. And when you look at the race and ethnicity, again, by the zip codes, the county and the state level, you see also that they are more diverse. So you have a higher percentage of residents that identify as Black and Latinx in the 33605, 33610, and 33612 area codes. When we looked at the median income is basically when you take a range of your income and looking right at the middle. And the per capita income is looking looking at the total amount of income in that particular area divided by the number of residents. And this is in 2018 dollars. And you see the, again, significant difference in lower income, both median and per capita, in these zip codes. And that when you look at 33612, they have one half, just 50% of the median income of the rest of Hillsborough County. So again, we've looked at the demographics in terms of race and ethnicity, and also in terms of the income. And then when you look at the languages spoken, still very diverse, more so in these this targeted area, with a blue bar indicating the languages other than English that is spoken at home. And then looking at the orange bar of the households with broadband internet subscription. Now, this is looking at 2014 to 2018, but this also gives us, looking at the past year with the pandemic, of some of the difficulties that the county and we've experienced in certain pockets in the area having access. And this is just the internet. We're not looking at sort of the technology and do you have a computer at home for school-aged children, but this can also provide in context of where there's maybe a greater need for technology. And then, so we talked about the demographics, the economics, and now look at the education. So when we're looking at this graph, and it shows in blue the percentage of high school graduates. Now they're looking at high school graduates, all those ages 25 and older that are high school graduates and above. And you see there are higher rates in the state of Florida and in Hillsborough County, and lower rates of high school graduates in these zip codes 33605, 33610, and 33612. It's even more dramatic when you look at the rates of bachelor's degrees and higher. So those who are 25 and older, those residents that have a bachelor's degree or higher. And it's more prominent with close to 16% of the residents in 33610 with bachelor's degree, compared to almost twice that in Hillsborough County of 32%. And then we look at homeownership rates. We look at homeownership rates as a means of generational wealth. So when you're thinking about whether or not you have your grandparents owned land that when they passed away, or great grandparents, when they passed away, that land was passed on, that house was passed on to the next generation. This shows, again, it's another marker of generational wealth. And you see that in certain parts of the county, there are very low rates of home ownership. The lowest 13.3% in zip code 33612. And that's, again, why it is referred to as a suitcase city. But then you have actually pretty higher rates, still lower than Hillsborough County and the state of Florida in 33610 and 33605. And so the importance of ensuring that those homeowners stay homeowners, that they are supported, and that those who are renters that want to own homes, that they have the means and they have the resources in order to transition from renter to home ownership. Again, looking at ways and opportunities that exist in this area, and how can Dr. Traci's house help to address some of the disparities that we see. And so we looked at all of this, looking at the poverty rates. And when you look at the blue bar looks at all persons, the percentage of persons that live in poverty. The striking part is when you look at the orange, and these are children less than 18 years of age that are living in poverty, range from 59% up to 51%. So just take a minute and just think about it. If you had a classroom of 20 children. And these zip codes, 33605, 33610, and 33612. 8 to 11 of those 20 children would be living in poverty. So when you think about the kids and the stress that they have to deal with, when you look at all of the other things that don't have anything to do, well, in what's going on in school, but what they're bringing to school. That is something that really has to be addressed in terms of the holistic, and how can we better nurture children and their families when they have so much more to deal with than what's going on and being taught to them in school. And I wanted to also highlight that, again, a lot of the activities and all of the things that I've talked about we talk about as social determinants of health, social risk factors or risk factors, socioeconomic risk factors, but they have an impact on one's not only physical health, but also the mental health. And this is from the Centers of Disease Control and Prevention, looking at chronic disease indicators for the state of Florida. And when you look at it, you see non-Hispanic Blacks almost have twice as high number of deaths per 100,000 than non-Hispanic whites. And they have the highest rate, non-Hispanic Blacks also the highest rate of lower extremity amputations. Now, it's not just one thing that is impacting that. It is this economics of whether they can afford their medication, that whether they can get time off to go to their doctors, in terms of the diagnosis, having access not only to primary care, but also specialty care, and also the education of being able to understand what's going on with them, what's going on with the disease process, and how they need to necessarily change their eating habits and the like. And then it's not just one person, but it's more of a sort of a family affair, especially when it's a chronic disease like diabetes or high blood pressure. The one, and this is going to be one of my final sort of slides in terms of painting that picture of the landscape of what Dr. Traci's house is going to be doing, is when you look at the non-promotion by gender in Hillsborough County. And this is from the survey that was taken in 2018 to 2019 from the Florida Department of Education. And you see, and again, looking at, they have non-promotion rates, and these are by the number of kids. The highest and most frequent areas or grades where kids are not promoted is kindergarten, first grade, second grade, third grade. Third grade is the peak, and then it is at 12th grade. But you see in each of these grades that the males, boys, are more likely not to be promoted than girls. And then when you break it down, not only by gender, but by race and ethnicity, again, it's still the same time period, looking at 2018 and 2019. You see the highest bar is the yellow and the gold color, and that's third grade. But that at each time, the Hispanic male, they are more likely to not be promoted, followed by Black males, then the Hispanic and Black females. And I wanted to really make this point, looking at the wonderful mentorship program that Hillsborough County Schools has. There's a huge opportunity for our Black and Brown boys, where we can do much in terms of seeing where we see there is a significant impact, and it's a negative impact that's being had because they're not being promoted. And we know that a lot of this shows, but it's shocking, but it's also telling that at kindergarten, that there are many kids that enter kindergarten behind. So looking at what is happening with early childhood education, what are we doing for birth to 5-year-olds to get them prepared for kindergarten so they can be successful kindergarten, first grade, second grade, and be able to be promoted into third grade, into fourth grade. So all of that, looking at that confluence of all that information, it showed me that when you think about, again, the child and the family, they're at the center. They're being at the center, that there is the economics. There is the being, do the parents make enough money or have access to education, training programs, and the support system in order to get higher paying jobs. There's access to food, access to healthy food, their medical and behavioral health, putting all of that and linking all of that together. That is where at the center, more of a collaborative model for Dr. Traci's house. And that's how sort of Dr. Traci's house came to being, of what can we do as an entity, Power One, being able to bring all the resources, medical behavioral health clinic, early childhood learning, nutritional services, the ancillary with the pharmacy, the dental, and also the workforce support, so that, and advanced career development, so that if someone wants to be able to go to school, they have access to the internet so that they can apply for the course. If it's an online course, making sure they have the tools for that. And also babysitting, if they need childcare. A lot of people would love to do more, would love to go to training programs, but need some place where their kids can be safe. They can help with after school homework, but so that they can go to school, so that they can take classes, they can study, they can take exams. So being able to be that resource and partner with other organizations, that's what we want to bring with Dr. Traci's house. And so looking at some of the key features of Dr. Traci's house, as I said, being a community resource and being a patient-centered medical clinic. As a physician, I understand the importance of being a doctor. People do listen to you, but being able as a physician to have all that information, have information about what's going on at home, and having the time and knowing the right questions to ask of what's going on at home. What are you you worried about? What's the most pressing thing going on in your life right now? And being able to help them, patients, and being able to see both pediatrics and adults, being able to get them in a safe place where they're able to communicate what's going on at home, and being able to know that they can be focused, the parents can be focused on what they're doing because their kid's not there in another place in Dr. Traci's house, but where someone is taking care of them, making sure that they're fed, and taking care of all of the family's needs. And being able to be in conjunction with the behavioral health, knowing that a lot of the main priority that was identified in the community health needs assessments for all of the major hospital systems in Tampa was mental health, and having access, but also and knowing that there is a stigma associated with getting seeking help, whether it's with depression, whether it's anxiety, adjustment, or substance abuse or substance use issues. That especially with the pandemic and it can be isolated, and knowing that it's very common. It's very common to feel depressed. It's common to have issues that you want to be able to discuss and just to talk it out with someone who was able to give you, whether it's a counselor, a psychiatrist, a psychologist, able to give you that additional information. Um, and then being able to address the nutritional need, being able to partner with other organizations that will be able to people come to get fed, because a lot of them have access to healthy choices in terms of food, and work with other partners, and knowing that although it is Dr. Tracy's House is one entity, that this is a collaborative effort. It's a collaborative effort with other organizations doing wonderful work here in the Tampa Bay area, but being able to put all those pieces together, especially the medical and behavioral health component, with all of the community resources together, and being able to have that very strong referral system. And we have upcoming plans with community events, knowing that we're going to be kicking off soon with this in terms of summer, with some activities for the kids. Want to have an opportunity to be open for the community with afternoon lunches, where I have a group of volunteers who will be rotating, who will want to, and I will kick it off, but it's afternoon with the doctor that you can drop in, be able to have an educational component. We'll feed you. But if you have any questions that you want to talk to, be able to do that, and we can send that over to your primary care doctor, but just have an opportunity to really talk with health professionals, and also working with our counterparts in the finance areas. And I'm excited to say that last week we officially closed on a property that is right off Nebraska Avenue, not too far from Hillsborough, Hillsborough Avenue, and that we are preparing for the build-up phase. Dr. Tracy's House was one of the proud recipients of the Tampa Bay Super Bowl 55 Host Committee Forever 55 Legacy Grant. Part of that grant is being used to provide a reading nook, a mobile reading nook for Oak Park Elementary School. Also in the process of getting an online read-alongs, where myself and other individuals in the community will be reading books to kids. So you'll have access to us reading to your kids. And also we've partnered with several organizations already who will help us, because we know that even though there is one entity that, Power of One, that it does take a village in order to create a very lasting, sustainable change. And now I don't know if we have questions. Angela, if you.
I am here. Thank you so much, Dr. Traci, for that overview of the vision that you have for our community. It's so I'm just so intrigued by what your vision is, what you're gonna do, what you have done, and I'm just so excited. I can't wait to partake in it and participate. You have my full support with all of your endeavors. So thank you for your passion.
You're welcome.
At this time, we are going to take any questions that you may have of Dr. Traci. You can, again, hover over the Q&A bar at the bottom of your screen or directly into the chat um, and ask any questions that you may have.
And I don't know if you have any questions that you would like to ask on behalf of the audience. Feel free.
So I do have questions. So the healthcare services that you provide, what kind of healthcare services will you be providing for families and children?
So it will be basic primary care. So well child visit, well woman visit, you know, adults to, immunizations, vaccinations, but doing a lot of education also. Again, the beauty of being a nonprofit organization, we want to be able to take care of everyone. So whether you have insurance or you're welcome to come. If you don't have insurance, we will welcome you. Also, we are in the process. Since I just closed on the property, it's going to take a while. So again, the soft launch will be more of the community outreach component, but we will definitely let you know when we're ready and open for business on the medical side.
Okay, perfect.
Yes, and I do see that, yes, there'll be a combination of medical care and social services. Yes. So part of what I've done, even in the process of going through this trying to secure a location, whether it is helping you understand how to fill out disability forms, understand, what is part of your benefit, and, whether any types of forms that need to be filled out, just walking you through that process. And those are the things that we'll be able to do at Dr. Traci's house.
Okay, you mentioned something about tutoring services.
Yes. Yes. So I'm part of another organization, Making Moves for Compassion, and we have a group of dynamic women and their spouses, and we're also already, I guess, level 2 cleared in terms of mentors for kids in Hillsborough County. So again, we do want to be able to do particular tutoring, and doing that after school.
Perfect. And how long have you been a physician practicing?
Practicing 21 years. Yes, 21 years.
How is that possible? You look 21.
I just had a birthday last week, so I'm loving that. I practice as a hospital-based physician. So I practice in East and West Coast and Central Florida when I moved down. I've been in Florida for about 17 years now. So worked in hospital, ER, worked on the floor, and also worked in the intensive care unit. So and that was before I moved over to the insurance side, but still did keep up seeing patients in the hospital for several years. So now I'm coming back. So I guess full circle from where I started working in the clinic. Oh, you're still on
tutoring for what ages?
So all ages. Now, if you get in terms of college age, we may have to, depending on the subject area, but we can do all ages. We'll be able to tutor for all ages.
And then a question came through the Q&A pane. How can myself and my daughter volunteer to read to children? They want to volunteer with Dr. Traci's house.
Okay, well, I will put up here, you can email me at Dr. Traci at drtracyshouse.org. I will get that information and we will work and get you on video.
Perfect. So if you want to volunteer, if there are any callers on the line that would like to volunteer, just email the email address on the page. They want to know, how can parents stay abreast on ongoing updates with what's happening with Dr. Traci's house?
So I do have a website. So at drtracyshouse.org. Also on Facebook, Twitter, and Instagram. I'm getting better at posting, but I'm more, as we're going in through the phases, I will be sure to update everyone on, you just have to Google Dr. Traci's house and my social media will come up and you'll be able to follow us there.
Very good. And they want to know if there's transportation support.
We will be working in conjunction with that. Many of the organizations have used, whether it's sort of subsidizing or having account with either Uber or Lyft to help with the transportation, and then we'll be connecting and working with the local faith-based organizations. Maybe there's a church van and working that a lot of the groups and what I do envision in terms of at least the beginning in terms of these community events, if there is a van that can go around and picking up people to drop them off when we're ready, drop them off, um, and then we'll have a sort of afternoon. They'll get fed. Again, following all of the CDC guidelines with face masks, social distancing, hand washing, and all of that. But we do have a pretty big backyard and be able to do it with weather permitting, people in the backyard and doing things like that. So
Very good. Now, you talked about housing a little bit earlier. What are your supports for families looking for housing to be homeowners? What is your plan? What is Dr. Tracy's House's plan to help with home ownership?
that is working with the local banks, working again, a lot of it is education of seeing what's available, what's out there, going through this whole process of securing this property. I know there's in terms of going through the basics of what's your credit score, looking to see how we can get clean things up and how we can get you on a program for home ownerships. But there are many programs out there with a lot of the financial institutions here in Tampa that want to give back, that I've been in contact with, and that help financed this part, Dr. Tracy's house, who are willing and able to provide, and they have free workshops. So be able to coordinate that is what we'll be able to do.
Great, great, great. Are there any other questions? I know that was a lot of information, a lot of things. And I mean, you are going to be that one-stop shop, and that's why I love the title. It takes a village, because you are the village, and so it's just you're providing everything for everything that everything we need again for health and wellness and sustainability. Um, oh, this is a great question. Are there going to be any requirements for the services that you provide?
Just that you're kind and friendly. That's it. That's it. I mean, yeah. Kind and friendly. I mean, that is it. There's no and that's one of the things that I really wanted to make sure that we're able to do. So if you don't have insurance, be able to come. But if you do have insurance, not to say that in this great programming, you want to be able to come too. So you can come. And so that is not, we're not turning anyone away. I have to brush up on my Spanish, but I do have some Spanish, we'll have some Spanish speaking bilingual people that will be able to communicate, and I'm gonna get my Spanish back, back up. But we most definitely, there's, no particular sort of requirements, or, you make too much money or don't make enough that.
So, also, will you be working with schools, like the social workers at the schools, or school counselors, to ensure that all key people are aware of the services that you provide to students?
Yes, most definitely. That will be one of the key items. We do have, as part of one of my organizations, a school social worker, so she'll be able to plug me in, and when I'm ready, plug me in to the necessary resources. And do have a social, actually a complex medical social worker that works for a pharmaceutical company that will be able to, is on the advisory board to assist too. So
Okay, I have another question. Are you partnering with any other community partners in education, such as Metropolitan Ministries, those types? And if so, who and how do those partnerships work?
so I am at the beginning phases. I will be the Metropolitan Ministries. There's a long list of people that I will be reaching out to. Again, my first again, the vision is huge. The vision is big. Just like I dream big. And I know that the first thing I wanted to do is at least have a place so that people can see that vision. But again, as I said, the key is partnership. I don't want to duplicate resources or duplicate activities or services that are already happening very well within the community. I want to be able to complement. So yes, Metropolitan Ministries, they're on my list. So if you're listening, I'm here. That's my email.
Awesome. Well, with that, I see that there are no, oh wait, I think we have another question. What is the best way to implement and teach parents to promote learning from birth to kindergarten, being that percentage of younger kids begin school behind grade level? Great question.
Yes. So I'll tell you how I learned. So way I was trained is we see one, do one, teach one. So in order for you to really learn, to parents have to see how to do it, and that requires having a sort of almost a live lab where they're able to come and actually see how it is that we engage and read to, I have pictures of my son. The book was bigger than him, and how I read to him every day. So they have to see that. So being able to show them how to do it, and then watching how they do it, and then they will be able to do it. So that is what really is the translational, basically translational science, and how we have to see it in action and has to be applied. So that's where we want to not just say things, but actually show them how to do it. And again, if we can, the key, maybe even train the trainer sort of process, where there's other daycares or early childhood learning entities in the East Tampa area, that training them to have time when parents can come in and they can see how they do some of the activities, and so they can be able to continue that, because the key is not to do it just when they're in, or just even school age, not just when you're in school, but do it even when they're out of school. So you have to sort of teach the parents those activities that you want them to continue when they're not in school.
Yeah, a lot of people forget that parents are their child's first teacher.
Mm-hmm.
And so, but a lot of us, there's no training to be, when you're a parent, there's no training. I was trained as a teacher because I went to college and became a teacher. So I was taught how to teach students.
Yeah.
And so then that helped me with raising my children because I was trained to teach
Correct.
children.
Mm-hmm.
But had I not had that training, I probably would not have known what to do.
And then you think about it. Okay, so we're saying we want parents to do all of this. We have these things, but they're trying to put food on the table. They're
Right.
trying to run home to pick up from before 6 o'clock from daycare, or they start get the late charges. They're trying to, figure out the new math. Let me not go there. But they're trying to figure out other things and all this other stuff that they don't have time. And it's no fault of their own, but they just don't have time. And that's why, creating, and I know that they're on their phones, because, they're on their phones. But so if I have, if they can't read, just go on the YouTube channel and I'm going to read to them. They will see me reading to them. So at least somebody's reading to them every night. Just put it on and just play it over and over again.
Mhm.
So
That's good. That's good there, Dr. Tracy. Awesome. All right. I think that is all the questions. Very good questions, attendees. Thank you for being with us again, Dr. Tracy. I'm so excited about Dr. Tracy's house, and I'm going to follow up because you have my mind going right now, and I think I have something, some entities, some partnering ideas for you. So I want to share those with you. So we'll get on a later call,
yeah,
probably later this week, to connect with you. But with that, I want to tell everybody thank you for being with us. We really enjoyed this session, and we're looking forward to all the work that Dr. Traci's house is going to bring to the community. With that, thank you for joining us. Again, if you want to revisit this presentation, it'll be on our YouTube page. Just go to up further in the chat. The link to our YouTube channel is there. Go ahead and subscribe to our channel. And don't forget before you leave to please put the name of your child's school inside the chat box. And with that, I want to tell everyone good night and have a great evening. Until next time.
Excellent. Bye-bye.